Hello guys, welcome to Homeo Health Care. Today we are going to discuss on the topic cervical spondylosis. What is it? It is an osteoarthritic condition of the cervical spine. Our human body has a vertebral column in which a spinal cord lies, and the proximal part of this vertebral column has termed as the cervical spine. Seven cervical vertebrae are there, named C1 to C7, and there this degenerative process gets occur. As in the earlier video, we have discussed that osteoarthritis is an degenerative joint disease. So, in which age group we will see this condition? Mostly, it will be about 50 years of age. But in the younger age group, also it can be seen. But to which peoples of this younger age group it can be seen? Those who are having less movement of the neck and working constantly with keeping the neck straight without movement, like reading, writing, working on any gadgets such as laptop, etc. This condition can be seen to they may suffer from the cervical spondylosis. What pathology is present? First and most, the pathology will start in the intervertebral disc. What is intervertebral disc? Between the two vertebrae, there is a space termed as intervertebral space. In this space, the disc lies, and that has been termed as intervertebral disc. So, the degenerative process will get occurs here. This leads to the reduction in the size of intervertebral disc, and due to this, there will be the intervertebral disc space reduction, along with formation of the osteophytes. Now, what these osteophytes will do there? It comes at the anterior side of vertebrae as well as the posterior side of vertebrae. What it will do? It will compress the nerve, due to which the radicular pain experiences by the patient. The spinal cord present there, that will also get compressed. What compression will be also seen, and which is the most common site where these pathological changes occur. That is the lower three intervertebral joints of the cervical spine. This site is most common for this degenerative joint disease. So, due to these pathological changes, what clinical features can be seen? Symptoms are very vague here in this condition, but the common symptoms which patient gives us are pain, stiffness of the neck. Initially, the pain in the neck or this stiffness will be intermittent. This condition will come and go, come and go, come and go. But as the disease gets progresses, the nerve root gets more compression. So after getting compressed, what function does nerves has to carry the impulses? Any sensations the experiences are due to these nerves, and when it gets compressed, these impulses travels more and more, and patient experiences more pain, and then the pain becomes permanent. And what type of pain will be there? It will be the radiating type of pain. Why radiating type of pain? Because the nerve root has compressed, and which nerve has compressed, and along with the which force does it has from here or here, that will be, along with that, the radiating type of pain will be there. That's why the nerve root compression has this radiating type of pain. Also, paresthesia. What does this paresthesia means? It means the tingling and numbness. These sensations will also present. And what will be there? Giddiness. Giddiness will also present. चक्कर जैसा लगना, चक्कर आना, मोस्टली सीधा देखे, ऊपर देखे तो चक्कर आता है. Along with this condition, you can rule out the cervical spondylosis. Another, what condition can be seen? Occipital headache. But when the occipital headache will be there. It will be there when the upper half of the cervical spine gets affected. The degenerative changes, osteophytic formation, when get occurs in the upper half of the cervical spine, at that time, the occipital headache can be seen. And for homeopaths, it can be a concomitant symptom also. What after that? What examination findings will be present? First and most, the movement of the neck will get restricted. Limitation of the cervical spine movements. That is, and after that, what can be seen? Loss of normal cervical lordosis. That condition will be also not present. The normal cervical lordosis will get lost. Tenderness over the cervical spine. When the physician examines, palpate the cervical spine, at that time tenderness will be there. This also can be seen. Then a sputtling test can also be performed here, but it will only rule out it is a cervicular radiculopathy. When the sputtling test is done and it comes positive, at that time it only indicates cervical radiculopathy. For that, the diagnosis may be different, but we can think of cervical spondylosis too. What after that? What investigations will be there and what investigation findings will come out? When the X-ray is taken in the AP and lateral view, there will be the space reduction, intervertebral joint space reduction, along with degenerative changes in the disc with osteophytic formation of the vertebrae. And due to these osteophytic formations, the nerve root get compressed. Also, there can be the narrowing of foraminal, and when this foramina gets narrowed, the nerve gets more and more compressed and the impulses travels more at that time. So these X-ray findings can be seen in the cervical spondylosis. What are the differential diagnoses for that? Cervical tumor, cervical disc prolapse. Mostly in cervical disc prolapse, in X-ray, it will show at the position of posterolateral side, it will get side. Due to this also, patient can experience some conditions similar to the cervical spondylosis. And spinal cord tumor, Also the carpal tunnel syndrome, there will be also similar pain. But in carpal tunnel syndrome, it gets affected to the wrist joint. When the pain gets started from the wrist and ends to the fingers, right? It is also a radiating type of pain, but ends to the finger. But from where its initiation is from the wrist joint. That's why from where the pain gets started, it is also important, because when this radiating type of pain is present in the cervical spondylosis, in few patients, it gets originated from the neck, but some may experience up to the arm, some may experience up to the forearm, some may experience up to the fingers, some may experience up to only the shoulders. This can be the conditions. Now, what about its treatment part? In homeopathy, after taking a case, after processing the case, what remedy comes up and that suits to the patient. After a course of treatment, the patient's suffering gets maximally decreased, and in few cases it can get disappear. There are few chances to get the pain, the symptoms to reappear in that patient. But after taking a case, जब कोई सर्वाइकल स्पॉन्डिलोसिस का पेशेंट आता है, उसकी जब केस ली जाती है, केस पे जब अच्छे से डिटेल में वर्क करने के बाद जो रेमेडी ऊपर आती है, वो उसको एडमिनिस्टर करने के बाद जब एक कोर्स ऑफ ट्रीटमेंट कंप्लीट होता है, उसके बाद जिस हालात में, जिस पेन के साथ, जिस इंटेंसिटी ऑफ कंप्लेंट्स के साथ वो आता है ना, उसको नहीं रहता है. जेव्हा एखादा व्यक्ती, एखादा पेशंट सर्वाइकल स्पॉन्डिलोसिसचा येतो, त्याची डिटेल केस घेतल्या जाते, त्या केसवर वर्कआउट केल्या जाते, त्यानंतर त्याच्यासाठी कोणतं चांगलं औषध निघून येतं वर ते त्याला देण्यात येईल आणि त्याच्यानंतर त्याला चांगल्यानी आराम पडेल एका पर्टिक्युलर कोर्स ऑफ ट्रीटमेंट नंतर. आणि तो ट्रीटमेंटचा कालावधी पूर्ण झाल्यावरती त्याला तितका त्रास पुन्हा अनुभवता येत नाही आणि त्रास चालला जातो. As we says, we treat the man in disease and not only the man in disease. आजारात आलेल्या व्यक्तीसाठी औषध देण्यात येतं, rather than फक्त आणि फक्त त्याच्या आजारावर देण्याऐवजी. So, if you like this video, then subscribe to my channel. Thank you.